Dr. Wudasi Asmara. I'm an internist and gastroenterologist and hepatologist. So I practice treating cardiovascular disease, renal disease, hormonal disorders, and various gastrointestinal disease. So my subspecialty mainly focus on gastroenterology and hepatology. So my routine procedures include endoscopy, both diagnostic and therapeutic, and colonoscopy, both diagnostic and therapeutic, primarily focusing on managing and treating colorectal disease. Endoscopy is a diagnostic procedure done by a trained gastroenterologist using a flexible tube. So the flexible tube will be inserted through the mouth under mild sedation, and the patient's intestinal tract, stomach and esophagus will be examined carefully. So it helps us to see and evaluate the internal part of our GI system, look for specific disease entities including cancers and ulcers, tumors and so on, so that treatment can be given in time. When we talk about indications for endoscopy, so we can fragment them into diagnostic and therapeutic. When we talk about diagnostic, we're trying to look for the specific etiology. So when a person presents with epigastric pain or discomfort which worsens following a meal, especially if it is accompanied by alarming symptoms or signs, which I will state now. So endoscopy is recommended. So the alarm symptoms that are important in leading us to do endoscopy are when a person have unexplained weight loss, unexplained anemia, bleeding per mouth or through the anus, when there is abdominal swelling which is unexplained, and when there is unexplained difficulty of swallowing or pain during swallowing. So these are the indications for diagnostic. For surveillance or for therapeutic, when a person has certain cancer in the past, we do surveillance endoscopy to look into the trace based on the previous diagnosis. For patients with GI bleeding, presenting with anemia or low blood pressure, dizziness and so on, so the endoscopy could help us look into the stomach or duodenum where the ulcer or the bleeding site is, and it can help us treat the bleeding site and prevent unnecessary procedures and morbidity. So the other importance of therapeutic endoscopy is removing foreign bodies which are swallowed suddenly during ingestion. So again, it can avoid unnecessary use of surgery or other invasive procedures. So by just doing endoscopy, we can insert a flexible material designed to remove the foreign body within 5 to 10 minutes. So it is totally safe and it needs minimal sedation only. So the procedure is very safe. It needs only 5 to 10 minutes and it's done under conscious sedation. It doesn't have any harm to the patient, it doesn't have any radiation, it doesn't cause any difficulty of eating or any other. So it just has only mild discomfort which lasts for 10 to 20 minutes and it goes away right away. So once the procedure is completed. So after endoscopy, a person may have some dizziness or sleepiness for 30 minutes or 1 hour. Otherwise, the patient will not have significant discomfort. So the patient can go after 30 minutes to his home. They can work, but because of the sedatives, so the patient is supposed to stay home for at least 12 to 24 hours. When it comes to colonoscopy, it is a little bit different from endoscopy. So the colonoscopy, typically the flexible tube is passed through the anus and it will be directed towards the small intestine, and the whole colon and part of the small intestine will be evaluated. So what makes it unique from endoscopy is it needs preparation for the bowel, as the food that we eat stays for 3 to 4 days before it is evacuated. So the colon has to be clean for the camera to visualize the entire colon effectively. So the nurse or the doctor will prescribe laxatives, certain laxatives and plenty of water a day before the procedure, and then the patient will expect to have loose stool and diarrhea, and then on the stated date of procedure they come with empty stomach, and the procedure takes usually 20 to 30 minutes, and it's not supposed to cause any significant discomfort. To add some important pointers, the indications for colonoscopy are usually when the person have bleeding per rectum, so it includes hemorrhoids or diverticula, which are outputs of the bowel, which may cause silent bleeding. But the most important thing, especially in people aged more than 45 years old, screening for colorectal cancer is very important, because colorectal cancer is becoming more common nowadays. So any person above age 45 is considered eligible for screening colonoscopy without having symptoms. Once the symptoms have occurred, it might be too late. So I encourage everyone to have diagnostic colonoscopy, and at the age of 45, and then if it is found to be normal, it's indicated to be done after 10 years. So the other indications for colonoscopy are unexplained weight loss, unexplained anemia, and unexplained abdominal pain, and bowel habit change. Thank you.